Doctor, how do I know I'm having a miscarriage? Well, the formal definition of miscarriage is loss of pregnancy before 24 weeks. Basically, with a miscarriage, you might experience certain symptoms. You might feel lightheaded or faint, you might feel dizzy, experiencing what we know as abdominal cramps or abdominal pain. Some women might have nausea, vomiting, headaches, lower backache, feeling that your heart's racing fast, and just feeling generally unwell. Now, there are different types of miscarriage. Now, one of the most common types is a chemical pregnancy. A lot of women do not actually know what a chemical pregnancy is or that they're experiencing a chemical pregnancy. So this can usually happen commonly around the 5th week of your pregnancy. And some women have what you call an unusual or very heavy period, where the period is so heavy that you're passing large clots, your sanitary pads are completely flooded, and you think, I'm just having a heavy period, because prior to this, you might not have experienced any symptoms of pregnancy. And maybe a few days or a week later, then you might experience some abdominal cramping pain, which you might just dismiss as maybe this could be part of my period. And that's what a chemical pregnancy virtually is. So chemical pregnancy is one of the early signs of a miscarriage, happening around the 5th week and presenting as a very heavy or unusual period. Now, another type of miscarriage is what we call an inevitable miscarriage. This means that the miscarriage is going to happen regardless. And a sign of this, again, is cramping abdominal pain. You feel this constant cramping sensation in your lower pelvic or lower abdominal region. And this is your uterus contracting to expel any products of conception. When you come to see the doctor would usually do a vaginal examination. If your cervix is open, then this means that you're having an inevitable miscarriage. Now, your cervix might be closed, and this is what we call a threatened miscarriage. Now, with a threatened miscarriage, you might not experience as much unusual or severe bleeding as you will do with an open or inevitable miscarriage, but this means that it is likely 50-50, it is likely that a miscarriage might happen, or you might keep the pregnancy. So at this point, when we examine the vagina, the cervix might still be closed, but we don't know if the cervix might become open later on. And this is where we usually advise we need to watch and monitor. Maybe we need to do a blood test or send it for an ultrasound. And that depends on how many weeks you are. So if you're before the age of 6 weeks in your pregnancy, most likely you have some blood tests done. Blood tests are usually done 48 hours apart to check if the levels are doubling. If the levels are not doubling, it means that the pregnancy is failing. If you're over 6 weeks, then we'd usually send you for an ultrasound scan to check for the heart rate, to check for the yolk sac, to make sure that the pregnancy is viable. So that's what we term a threatened miscarriage. Now, you can also have what we call a missed miscarriage. A missed miscarriage means that you lost a pregnancy early on, but you might not have experienced any symptoms to have told you that you lost a pregnancy. It's usually discovered if maybe all of a sudden you're not experiencing any pregnancy symptoms such as nausea or fatigue, or you might have gone for your pregnancy scan and they've told you that there is no heart rate or there is no fetus. So you could be thinking you're 12 weeks, but the pregnancy scan shows that you're maybe 6 weeks or 9 weeks. So that's what we call a missed miscarriage. So it could be that later on you start experiencing the symptoms and signs of a miscarriage that I mentioned earlier, such as, heavy bleeding or abdominal cramps. Then you also have what we call a complete or incomplete miscarriage. An incomplete miscarriage means that you've not expelled all the products of conception from the uterus. So you might experience symptoms such as ongoing abdominal cramping. This can last for days or weeks. And at this stage, your doctor might give you options of, do you want to watch and monitor? Do you want to take medication that would accelerate the expulsion of the products of conception? Or do you want to go for surgery? In terms of complete miscarriage, as the name says, complete miscarriage means you've completely expelled all the products of conception from the uterus and there's nothing left. So usually at this point, you do not experience any symptoms. Now, with any of these causes of miscarriage that I've explained, you might still be having positive pregnancy tests. And you might be thinking, am I still pregnant? Because you might have that faint hope, that possibility of, okay, maybe I'm still pregnant, maybe I'm not losing the baby, or why am I still having positive urine pregnancy tests? Now, just because you've had a miscarriage does not mean that you've lost all pregnancy hormones, because it takes a while for the pregnancy hormones to actually leave your body. So even up to 4 to 6 weeks after you've miscarried, you might still be testing positive for urine. So in this scenario, it might be best to do a urine test maybe 4 to 6 weeks after you've miscarried, or it's more accurate to do what we call the HCG blood test, as I mentioned earlier. So the HCG blood test will tell you if the pregnancy is failing or if you're no longer pregnant. So if you're 6 weeks and you're having an HCG blood test of about 400, when really you should be around, let's say for example 4,000, then this is unlikely that you're having a viable pregnancy or you've already miscarried. Now, hope you've all understood this video. Please feel free to ask any questions and drop any comments in the comment section.